So thank you so much, Dr.
course.
Stern, for being here with us in Cancun.
Of course, it's an honor. Thank you.
Thanks so much for that, and it's been an amazing meeting. And I just wanted to ask you a few questions about
Sure.
your presentation. So first of all, about endourology, what would you do in your normal practice with an asymptomatic stone, kidney stone?
Asymptomatic stone, it's really so patient dependent. I think you have to have a discussion with the patient and decide what's important to them. Are they bothered by the fact that it's there? Does it keep them up at night? Are they worried about a stone event? I would say most of the patients who make their way to me are worried about stone events. That's why they're there. And so oftentimes I will offer treatment.
You will offer treatment. Is there any way that you evaluate also like interval growth, like in follow-up, or do you always go for treatment?
I'm always offered just to follow it, and just see what it's done. A lot of patients have had prior imaging, so we can check for growth. But regardless of growth, I think if it's growing faster, we'll have a tendency to move towards treatment a little bit faster.
Okay.
But even if it hasn't grown, if it's been stable, again, we can't predict what's going to happen to it.
Okay.
So if they want treatment, I'm okay with that.
Okay, thank you for that. Also, I wanted to ask you about intrarenal pressure and the new uteroscopes. Do you think there's going to be any change in the management, like in the future, with that and infections? Or because right now we don't know the values of the pressure, but do you think there's going to be any changes in the future with that?
I think we have to see what happens in the next couple of years. With the scope that's just come out, all the research is being done. We're following that up. We're getting that sepsis data. And so I think within a year or two, we're really going to know if it makes a difference.
Okay. Thank you. And my last question that I wanted to ask, I know that TFL is pretty good, and I saw that you've been using it in the ureter. What is your preferred settings for that?
Yep. So I use low energy in the ureter.
Okay.
I actually like 1 joule and 2 hertz. That's
Okay.
my go-to setting in the ureter.
And you have seen that you have the same fragmentation, or you always try to do dust in the ureter?
I do a combination.
Okay.
So I think dusting is nice with a little bit of fragmentation. That way you decrease the amount of trips you're doing in and out. And so I do a combination.
And do you think it could harm the ureter in comparison with the Holmium, or is practically the same with the TFL and the Holmium?
I haven't seen that. I know that's, in the literature, and that's a little bit of a worrisome thing, but I've been using TFL exclusively now for, about 5 years, 4.5 years, and we haven't had any issues, fortunately. So I think low energy and being really careful to stay off the wall, and I think it's a safe device.
Okay, so for say TFL is your to-go laser for every case.
It is.
Okay, that's pretty good. Well,
It's also quiet. That's my #1 reason.
Okay.
Yeah.
Well, thank you so much, Dr. Stern. I really appreciate it.
Thank you so much. Appreciate it.